I'm Dr. Brian Bates. I'm a general surgeon with Lakeland General Surgery. We're located in Lakeland Medical Suites across the street from the hospital in Niles. I'm married. My wife is originally from India, but she grew up in Berrien Springs in this area. And that was one of the reasons why we came back to this area, because she wanted to be closer to her parents as they were getting older. I have 3 boys. The oldest is going to be 25 soon. He's just finished grad school. I have a second one who's doing engineering at Andrews University. And my youngest one is still in academy. He's 16 years old. I enjoyed it when I went to college in this area. And I've always enjoyed the 4 seasons until I was in the tropics for a while. And I'm looking forward to enjoying the 4 seasons again, although this winter might be a little rough one. I didn't really plan on doing general surgery until I was in medical school, and once I was on my clinical rotations, I decided that was where I really wanted to go, and I haven't really looked back. I've really enjoyed my career so far. I finished my residency about 21 years ago, so I've been practicing general surgery for 21 years. Originally with the Air Force, and then with a clinic in Guam, and now with Lakeland Niles. I'm originally from Maine. I grew up in Maine. I went to high school in the Boston area, and then I came out to Michigan. I went to Andrews University in Berrien Springs for undergrad. After that, I went on to medical school in California at Loma Linda University. Came back to Michigan to Pontiac to do my surgery residency, and then on to the Air Force. Most recently, I spent the past 16 years on the island of Guam working for the Seventh-day Adventist Clinic on Guam. And that was a very positive experience. The island of Guam was a very nice place. The people are very nice. There was such a need for medical services, especially with surgery. Very broad spectrum of general surgery there. Basically, there were almost no subspecialists, and we had to do almost everything. Both general surgeons and gastroenterologists do endoscopy. Not all general surgeons are going to be doing endoscopy if they don't wish to. I think most of them do it. It really depends on what the need and demand in the area is, and that there's subspecialization. I think in my practice, I've always been doing endoscopy just because everywhere I went, there was a need for endoscopy, and I think I've gotten very good at it, and I enjoy doing it. The things I like most about general surgery is that really we do have an opportunity to impact people in a very positive way and in life-changing ways. And it's really gratifying to know that I made an impact on that person or saved that person's life or made things better for them. And the appreciation they show is very gratifying.